Wonderful. Okay, we got that going. Thank you everyone for being here. I'm going to kick us off. My name is Joy Brand Richardson. I am the Vice President of Professional Development at JCC Association. And a quote from the Psalm 133, "Behold how good and pleasant it is when all people live together as one." And we here at JCC Association are providing these peer community gatherings so that we can hear from experts in the field. Some of them are joining us from JCCs and some of them are outside professionals as well. We bring these peer communities to you on a semi-regular basis. They are hosted by chair people who I will introduce to you in a moment. And today we are gathering with a small panel who will give you some insights into their work and the gatherings that you do as well. So I want to introduce you to our chair people for this peer community. We have Michelle Eisenberg, whose camera is not working today. She is the Human Resource Director at the Mandel JCC of Cleveland. And we also have Ashley King, who is the Human Resource Director at Shalom Austin JCC. And they have put together a wonderful panel presentation for you and session that will be about an hour. You can read their full bios on JCC Resource Center. Right now, I'm going to turn it over to Michelle and Ashley to unmute themselves and say hello and get us started.
Good afternoon again, Michelle Eisenberg from the Mandel JCC in Cleveland. I'm the Chief Human Resource Officer here. Welcome all of you. We thought it was important to gather people together in these current times to talk about how we're best supporting our staff and how we, in various manners and various different backgrounds and beliefs, as many things have come to the forefront in recent weeks since the war breakout, as well as just life in general and the holidays and such. So I'm going to pass it to Ashley now, who can kind of start off and introduce who our panelists are, who will provide bios on themselves.
Hey everyone, Ashley King. I'm the HR Director at Shalom Austin, and really excited to be here today. And joining me today, I have Emma Howitt, who is our Senior Clinical Director from Jewish Family Service here in Austin. And I will let her just introduce herself a little bit more also.
Real quick before Emma does, please, if you have questions throughout this process, please put them in chat and they're being monitored, and we'll answer them all at the end so we don't interrupt the flow of the panel. And because we definitely want to make sure we address everything that is of concern with all of you. Thanks.
And just to frame this a little bit more, we just wanted to have a space for everyone to ask questions, have a space to see how we are keeping resilient during these times. So Emma, if you want to start us off, go for it. Just an introduction about yourself.
Thank you. Thank you for having me here today. I'm Emma Howitt. I am the Senior Clinical Director for Shalom Austin Jewish Family Service. I oversee all of our clinical services and programs, including the therapists that provide all of those services. I'm myself a therapist, a licensed professional counselor in the state of Texas, and I've worked in nonprofits my whole career, and have worked in the Jewish professional world for almost 8 years. And I'm really passionate about the sort of organizational self-care that it takes to help prevent burnout and encourage retention. Thanks for having me. I'm excited to talk about this topic.
Thanks, Emma, for joining us. I'd now like to pass over to Jill Sadowski, who is new with the Mandel JCC here in Cleveland, but been in the Jewish nonprofit world forever, but originally started her career here at the JCC. I won't tell you how many years ago. She can share if she'd like to tell us a little bit about herself and her background.
Hi, everybody. Thank you for having me. As Michelle said, I'm Jill Sadowski. I'm at the Mandel JCC. Today is day 11. It was actually my first job at the JCC out of college, go Bucks, Ohio State. And I currently at that point ran our children and youth programs, after school vacation programs, things like that. Fast forward, I got my master's in social work from the Wurzweiler School of Social Work at Yeshiva, and had also had some time at Jewish Family Services. And then most recently, I have been at Belfair Jewish Children's Bureau, a large child and family mental health, foster care, adoption, residential treatment. And I've been at Belfair for 26 years. So it's kind of a returning home. My role at the JCC is I'm senior manager over camping, children and youth services. So I'm also a licensed independent social worker with supervision capabilities. And as I was leaving Belfair and realizing the roles I've played, a piece of coming back to the JCC was also making sure that I'd be able to continue that supportive or official or unofficial support to people working in the field. And then I also, with another small hat, spent some time at a private practice. So thanks for having me.
We have Gideon with us, Culver from K Street Coaching, and he offers coaching services to many organizations. I will pass it off to him to give you more detail about what he could bring to the table, what he could add to our JCC lives as far as benefits moving forward, as well as his experiences in working with staff.
My name is Gideon Coleman, and I am indeed the president of K Street Coaching in Washington, D.C. I've been working as an executive coach for about 12 years professionally, and hold the International Coaching Federation's Master Certified Coach credential. At the beginning of the war, a couple weeks in, a friend of mine, you may have seen this on the news, someone that I'd volunteered alongside of was murdered in Detroit, and it just obliterated me. And in trying to figure out an adequate response, I thought to myself, we all need help moving forward. We need to lower the temperature, create room for better thinking and healthier action. I have a network of coaches at the highest levels and everything under that spans the world. I need to draw upon them and direct volunteer activity to Jewish nonprofit professionals. Most of my work is not with nonprofits, but I have worked with Jewish nonprofit professionals, people at JCCs in the past. I know for a fact that on October 6th, people were busy beyond their limits and things have just gotten worse. And I have created an informal network of coaches, mostly Jewish coaches, but we're broadening that is able and very willing to be of service to Jewish nonprofit professionals at this time. And I'll elaborate more on that later in the panel.
Thank you, Gideon. Ashley?
Awesome. All right. Thank you, everyone. So now we're just going to open it up. If you want to put any questions in the chat, we're more than happy to answer any questions that way. Anything going on at your JCC that comes to mind that you would like some guidance on? And we just wanted this to be a space where we could all just talk with each other and see what we're all doing, see what's working.
Also, if you want to share things that you're doing there to support your staff that maybe would be important for other JCCs to do something similar, or maybe we're all doing the same things and we can come up with new solutions, or if any of our panels have additional resources they'd like to share either in the chat or verbally, that'd be great as well.
One question that we just had was, how is everyone holding up? I know at our JCC, we especially right after October 7th, we had some sessions Emma, I don't know if you have anything to say more about what we've done to support our staff here.
Sure. Yeah, we've made sure to organize different support sessions for staff, especially in that first week immediately after October 7th, but also just ongoing encouragement to the staff to really take care of themselves, to really practice that self-care that I think all of us as humans need to do that work for ourselves, especially right now. And generally we just created spaces where people were, allowed to come and share what's hard about what's happening, and sort of be in the vulnerable place in order to move, forward into the next piece of this really hard work that we're all doing.
I was going to
Thank you.
add one thing to that. Just I've seen and this is not as much relative from my 2 weeks here, but when we call it an official come, share, talk, I'm much less prone to have people as when if I'm in an agency or a Jewish day school and you're walking through the halls, and certainly at the beginning, it was with many of our Israeli staff, of that's when you were able to, in kind of that much more natural setting. And I think that's how many people I'm seeing. It's just the check-ins individually as opposed to the larger offering social work support in this room all day. And I'm curious, are others finding that as well?
In the chat, and I think it's a big question for everybody, is how are we dealing with staff, non-Jewish versus Jewish staff versus people of different beliefs, and how are we managing that situation? I think I want to take that to the panelists for their advice on that, because I think that's a broad range thing here, right? Our agencies are not 100% Jewish, our membership's not 100% Jewish. We've even had members come in and complain that someone came in dressed that they felt was inappropriately, and why do we allow them to be a member? And so, like, how do we approach those, or staff that are pro-Palestinian that we didn't know when we hired them, obviously, until a war broke out? And how do we still, but they bring value to the team and they are engaged in their work and they do their work, but people are saying, well, why do you allow them to work here? And so I think I'd like to take that question and make it broader to the panelists to answer first. I'd love for the other JCCs to chime in on what their experiences are, as well as what they've done to curtail or manage that. So whoever would like to take it first, Emma or Jill or Gideon, that'd be great.
I'll just say that I'm shy about jumping in first as a non-JCC staff member, but I'll do it anyway. This is relevant to an experience I had this morning where I was sharing with a non-Jewish friend the need to look at the testimony yesterday from the House Education and Workforce Committee. There was an obscene exchange, and this is a non-Jewish friend who came back and said, well, I also want to see what they have to say about Islamophobia. Fair point. And I think that there are differences in the way personnel are able to listen right now. If we don't acknowledge someone's unique pain, there is no moving forward. And the ways we have done that in the past are just different from the ways that we need to do that right now. And I think that recognizing that there is specialized listening, perhaps triage and listening that needs to happen to even perform basic functions is extremely important.
Yeah, I would say, I mean, this is such a unique challenge that our organizations have, because we are organizations that, likely have a pretty clear stance on Israel. And so, at least on the sort of organizational level, But when we get down to the people who make up the organizations, that is a broad spectrum of personal beliefs and values and where people get their information from and all of those pieces. And I think organizationally, it's important to at least just acknowledge the fact that not everybody is going to have the same thoughts or feelings about what's happening. And being able to just name that, I think, is incredibly helpful to those who might feel, very differently from the organization's stance right now. And it may be, good to sort of invite those people to have private conversations, and, say if there are things that you have concerns about. Human resources is a great place to come and to express those concerns. But encouraging the private conversations over sort of the public debate that can snowball really quickly, get out of hand.
Thanks, Emma.
Jill, do you have anything to add to that?
Well, I saw Denise raise her hand if we want to go there. I was going to piggyback on top of it. I think those larger discussions are dangerous and hurt feelings, and it's very hard to repair things like that, certainly at this time. So exactly, it's the acknowledgement, it's just the reminding of we're all here working towards the success of our programs, and realizing people do have different views, and to give that space much more privately as opposed to large scale and public, because I just think things can be so broken they can't be repaired.
You can unmute.
I thought it was. Can you hear me? So interestingly enough, you guys went down a different avenue than I actually, my comment in the chat was. We really are not in our building having problems with people who are pro-Palestinian or pro-Israel. We really are not having those kinds of problems. It's more of people who maybe are Israeli or Jewish, kind of making other people feel like they're never going to understand what Jewish people are going through as a group, and nobody's really said anything. So has anybody had that experience? And the only way I can think of maybe even addressing some of that is have an after hours, just acknowledge that people are feeling stress on all sides, and maybe say after work hours we'll have meetings, or you guys can get together and you can have not a committee meeting, but just some kind of I bet you the stress would stop if they have to stay after hours, but I don't know. I'm not sure what the solution is, and it hasn't built up to a really bad tension, but there has been some tension around that because we have many people who are not Jewish in the building, but still feel, the same way Israelis do and Jewish people do about a lot of stuff. I've never had anybody come in my office and talk about Palestinian or Jewish on political sides of that. And I would probably back away from that if they did. I mean, kind of keep it really low key because I could see that being a problem. Luckily, I've not had to deal with it. So have any of you guys had any of those problems and talked about meetings or anything like that? And I'll mute myself, let you guys answer.
I think our issue here more, Denise, has been how do we balance the information we share and not overreact or overshare, but also make sure that we stand behind Israel and we support Israel, but at the same time, we don't necessarily overshare in the sense of making people uncomfortable in the building for what they believe, right? So in the sense of maybe we don't put every poster up of every hostage or whatever, but we have stuff streaming on like a screen and people can look if they like to, but like it's not in their face when they walk in the building, that yet we have Jewish flags in the building and in the parking lots and all those kinds of things, right? So I think it's finding that balance for us here. Plus, and it was difficult because we had a new shaliach here in Cleveland that just started literally 3 weeks before the war broke out, and helping her adapt currently to being away from her homeland, being away from her family, and her mental health and her settling in, as well as her wanting everything to be about this 24/7 and sharing that it can't be, because then we give in, right? That we give into the war, we give into that feeling that we need to still show that life goes on to some extent, even though we support and we do and we help, but we still need to like live and laugh and learn and not, it shouldn't be all encompassing in our daily life, because that's not mentally healthy either. And it's not mentally healthy for her either, right? And I think we're slowly getting there. So what she's done instead is created like lunch and learns. Anybody can come anytime they want, just to learn more about Israel in general, the country, not the war, right? Or to learn about a topic. And if people share in that meeting and they get off topic, that's fine. And she does them a couple times a month. We've done them like 3 times, I think, so far. Another one's this week, where it's open. Anybody can pop in, pop out, share their concerns, or learn about whatever the topic is that month, or request another topic to try and like bridge the knowledge gap more than the fear of the unknown. Jill, do you have anything to add to that? Like, did I hit it pretty well, or?
No, I actually was going to bring up the example of, as you shared, people expecting that we should have more here, more pictures, more science. And, I think something many of all our members don't acknowledge or get into, as they shouldn't, is, that whole security piece and how much can be outside or should be outside. And so we have to leave that to the experts to help guide us. And that's probably the only piece. And I think, as everyone's aware, it's reminding people that, like, if you're feeling overly stressed, this is added to it. And I think now that it's been a few weeks, people are kind of thinking they should just be functioning at status quo, and they forget that this is all back here while we're still trying to keep functioning. As I had a text back from a friend in Israel, said, it's crazy, but we're living as close to normal, but with the sirens and knowing where to go. So I think people don't always acknowledge how much it's affecting us. And basics of limit your screen time, limit your social media, all those pieces help our staff as well as ourselves.
I think it's more about, this whole conversation is more about general mental health. I think the war has escalated that, but I think the common thing I've heard in the last year here at the agency in general is, I'm stressed, I'm overwhelmed, I'm depressed, I'm whatever, right? And we've given them different resources to try and guide them and help them to get them coaching and counseling as they've needed. We've gone through major changes here at our agency. There's been trauma in many different ways here with different things that have occurred, and trying to find that balance. I think this conversation should also go well beyond the war. I think because, EAPs are overwhelmed in the country. They can't keep up with the requests they're getting for support to people. Even if though you provide them, they only have so many resources or people that can respond quick enough. And some of these things, beyond the EAPs, what are we offering for staff's mental health? What are we doing for behavioral health? What else could we be doing? Does anybody have things that they've used to, support their staff that we can share amongst our group to help us all? Because that's what the purpose of this is, right? Is how we can help each other. And I think that different parts of the country, different areas do it better than others, and different agencies do it better than others. And what can we all pull together to change the culture of mental health in our agencies, right? Because I think that's a concern across the board. Everyone I've spoken to, as we move forward, and more health plans are, minimizing mental health coverage when they should be maximizing it.
May I ask a question of Denise? At the heart of the issue you raised, is it something along the lines of the stress or the experience that I'm feeling as a Jewish person is something that nobody who is not Jewish can possibly comprehend.
Yeah, that's exactly what's going on. Even though, I mean, everybody that works in our building, I mean, we have Federation here, we have HDS here, we have, our JCC. There is a lot of political stuff that's posted because Federation being here also, but that's exactly the point of it. And I think the hardest part is that, and I do speak to people who feel like nobody can possibly understand the way they're feeling and about how they're approaching other people. Um, I think the last few years has just been incredible for everybody, right? Not just the war, but everything going on monetarily in the countries, and I mean, it's just been very stressful. COVID, all of it, right? And people are just kind of um overwhelmed, and then this war was kind of like the last straw, and it felt very personal to very many people who have friends and relatives that are over in Israel, as it should feel personal. Um, and I'm not sure what to say or how to let those people who are not Jewish in our organization know that the way people who are Jewish are feeling is also not a personal um I don't even know the word I'm trying to say. It's not, they're not trying to make those people who there are coworkers and their friends and work well together with feel like they're not part of it, because they all are part of it. We all are. So, but yeah, and everybody's feelings is a little bit different, right? Not every single person in the organization feels the same way, or feels like they're left out, or has the same stresses or same tension. Um, as the other person. You have any, Gideon, is that your name?
It is. Thank you. Where I'd go with this is that, it seems like the baseline level of stress is through the roof anyway. And as people are grappling with this and struggling to accept that anyone might possibly understand where they're coming from until they have the experience of feeling heard, not just as someone in anguish, but someone in a very particular Jewish type of anguish by someone who can possibly comprehend that, they may just be stuck.
Well, I think everybody goes through some kind of hurt and some kind of pain. It may not be war related, but if people just going through life go through a lot of hurt and a lot of pain, maybe they have people who've passed away, or so people can relate. And I just want to find a constructive way. It hasn't become a big problem here, but before it does, I want to find a constructive way where maybe I can bring them all together so everybody can just kind of talk through some of what they're feeling on both sides. And maybe
So
that's not the
Gideon,
best idea. I don't know.
Gideon, that goes back to like one of the things you offered or shared, and maybe you could share a little bit more about what you can do to help some of these agencies go through some of these things if they're willing to take advantage of things that you would share that maybe would benefit Denise in the small group that she's dealing with there. Yeah, is this a good point to go through that, or?
I think it might be. I've been really just trying to get a feel for what would serve JCCs, but one thing that I'm hearing, and I would shy away from going big ecumenical group with the situation that you're talking about, Denise, for starters, because I don't think what you're describing is a situation where people would at first be helped by hearing everybody in the round. Back to what I think Jill was saying about the potential to do irreparable damage. But I think that there are people who need to name how they feel like nobody can understand them, and have sympathetic listening going on for that, either individually or in very well curated groups where the feeling of nobody gets this is similar. And in terms of specific offerings, I think the value proposition that the network of coaches I've been assembling can bring to the table is that they're able, personnel would be able to process whatever is going on with someone who's a complete outsider to the organization. They'd be able to process it with someone who is wonderfully equipped to truly hear them, to leave them feeling truly heard, and who has an ethical obligation to keep it confidential. So good ears, nobody needs to ever hear about this outside the organization. It'll just be a conversation that helps people to move on, whether it's a group one or an individual one. That's something that my network can offer.
Can you explain a little bit about how you're doing that with Hillel currently, just so they get an understanding of where this came from?
Yeah, so this is something that I've built on the fly, but I connected with Hillel and they put out a call to anyone who was looking for a coach with a brief description about what the coaching could provide. And people who raised their hand have been matched with coaches who've raised their hand to offer their time and services. My thinking is we want to have small offerings here, maybe, one group session or 1 to say 3 individual sessions, depending on what you think the need is. But we can match people, we can match personnel at your JCC with a coach who is either Jewish, or if that's not an issue, we can match them with a coach who is wonderfully equipped to hear them, who doesn't need to be Jewish.
As we continue to think about this topic and discuss it, right? Anybody who's interested in connecting with Gideon directly, if anybody you feel your team would benefit from it, a small group, or somebody that's on your team one-on-one could benefit from this, I think that if you could email me, and I'll put my email in the chat in a minute, email me with what you're thinking your JCC could most benefit from, and the best point of contact, and maybe like a subject, not necessarily like like if it's a group, like what the group's experience, or if it's an individual, if it's trauma, if it's war, if whatever will be, without too much specifics, at least I can give him, I'm gonna pass everything over to Gideon in one big email, people's contact information they're looking for something like this, and he can connect coaches with you, for those few sessions that they're offering, as a complimentary test out, see if it works for you. And if the determination would be if you want to continue work moving forward, that would be up to each JCC individually.
Yeah.
But I think that, this is something that we all could benefit from in various different ways for our own agency. And we all know what the needs are specifically for our agencies to share. But again, to help him manage the flow of the number of JCCs that could want this service, I'm going to ask you just to kind of send me a brief email of your name, the JCC, who the contact person is for this, so I can connect Gideon with it, so he can provide the intake that he needs to you directly. What other questions I'm sorry.
I just want to add one thing. If this is of interest, the turnaround time on connecting you to people who can help will be rapid.
Great. I wanted to add on to that, because I think, having those resources, especially something that's external like this for your organization, I think is really powerful and can be really helpful for employees to feel that there's a safe zone for them to really talk through what they're feeling and how the personal professional stuff kind of overlaps. The other piece that came to mind with Denise's question was, I saw that JPro is doing a training on anti-Semitism and allyship. And so for the staff members that are not Jewish, but really interested in growing their allyship, and I think, Michelle, you also mentioned trainings about Israel, just sort of providing general education and making that optional for staff, but giving them access to more of those resources can be really helpful. And it also, if you send that information out to all the staff, everybody sort of understands that there's a message being communicated about togetherness and that we're, all on the same team. And I think that's a big piece of, how you can kind of send messages really broadly, but also target those folks who have these really specific challenges that are happening in your organization.
So this is not generally a quiet group, so I'd love for other people to chime in with their experiences with their JCCs to be able to share, any tidbits you have or resources you've found useful at your JCC to support staff.
Feel free to put it in the chat if you don't want to talk. In the meantime, I was going to have Emma talk about just some self-care things that she has found that's been useful for our staff and for herself.
Yeah, I mean, we talked a little bit about how the stress levels have been high, not just since October 7th. Really, for many years, we've been struggling with that high stress. And I imagine y'all are seeing burnout in your organizations as well. It's easy to kind of think of burnout and stress as the same thing. But really, burnout is what happens when we're exposed to more stress than we are given resources to cope with that stress. And resources look a lot of ways. They look like time or technology or team members or budget or emotional support. And I think a big piece of how we combat that is that self-care. And self-care is not just a bath. That's a mantra of mine, especially as a therapist. Self-care is really the process of taking care of yourself with behaviors that promote health. So my favorite example is if I have a headache, I take an Advil. And so, if I find that the headache persists, then I might go see a doctor. I might take an additional step. And so recognizing that same logic should absolutely apply when we're really looking to take care of ourselves in terms of our mental health and our stress. And, setting healthy boundaries in the workplace is probably my top recommendation in terms of managing stress and, building up self-care in the workplace. Boundaries are how we teach people how to treat us. It's a way of communicating what our needs are and what our wants are. And the leaders in our organization can also communicate that with how they care for themselves. And so I've found that's a big impact, really leading by example, taking time off throughout the year, spreading it out and taking a day off here and there and calling it a mental health day and being really open about the fact that that is a need that I have as a human. It encourages my staff to do the same for themselves. And my staff in particular are therapists, and they're holding a lot of emotional space for folks in our community who are struggling. And so it's important for them to know that they have to fill up their own cup in order to help the other folks and pour into theirs in our community. And so really encouraging that with those actions in terms of leadership make a huge difference. And it gives people permission to do what they need to do. And boundaries can be anything from setting an agenda for a meeting to taking your lunch break. One of my favorite ones is instant messages do not require instant replies. So if you're, really focused on being present in your meeting and you're getting instant messages, it doesn't mean you have to stop and pay attention to those things. And remembering that, other people's urgency in the workplace doesn't necessarily mean that we have to sort of jump to. We get to determine where our priorities in that, workday are. And of course, we get guidance from our supervisors as well in that realm.
Emma, may I echo what you're saying here? Just from my perch as an executive coach, leadership matters, leadership matters, leadership matters. And when an organization has a leader who can demonstrate that they're not perfectly put together, they're not polished, they're not infallible, it just sets the tone for everybody throughout the organization to engage in behaviors that promote the health of the organization, that promote the health of each individual. So I just want to underline everything Emma said and say, yes, yes, yes.
I would be right along with you. I think I'm gonna say something that maybe people are thinking but not verbalizing. Um, I certainly know it was my last place of employment, and I'm getting a sense it might be here as well. The do as I say, not as I do, because there's a lot of work. And I think our staff do need to see it, which means we have to take a look at ourselves and say, like, I'm not responding after this time, or I'm not even sending it. And that's a harsh reality because there's a lot to do. But it it's got to start with us as well, and you all and the people you work with, to make those steps.
I think something that can have a pretty big impact that isn't time consuming is, when you're having one-to-one meetings with folks, just taking the time at the beginning to check in and to say, really, how are you doing? It's not how is your work going? What's the progress on this project? But like, how are you as a human doing today and this week? And what can I do to give you some support if the answer is, not my best? And to echo what Gideon was saying, I think in leadership, being able to show your own vulnerability has a huge splash for staff. To be able to own your mistakes, or to come in and say, like, I'm having a hard week, or I'm not hitting the deadlines that I planned, for myself, and that's hard for me. That really helps people understand that we're not expected to be perfect, because that's not an attainable goal for anyone anyway. So being able to show people with your actions and with that vulnerability, and not necessarily oversharing, but being able to say, there's stuff in my life that is taking up more space than it usually does, and that's a hard thing for me right now. So if you notice me a little distracted, that might be why. And just putting it out there so that people understand you're as human as they are.
So we're talking about resources and different things we provide to our staff. I know I've been researching EAPs for here because I think they all offer different benefits to staff. And I think the ones you get free a lot of times with your ancillary benefits are not as strong as they could be. Spring Health has been brought to my attention as a very strong mental health provider for EAPs. Does anybody have experience with them or with a different program that works well at your JCC?
I wanted to say that we did have an EAP at Shalom Austin. I mean, we have one this year, and we are switching to our ancillary one for next year. So I'm excited to see, and we'll see how it is. We'll see how it is. But our EAP wasn't utilized enough for us to be paying for it, separately here. So, I have heard that the people that did reach out did find it very useful. And I also wanted to just say just some other resources. I know that Emma mentioned the one training from, was it JFNA? Yeah. And JPro. And then, just wanted to see if also there are any other trainings or any other professional development opportunities that y'all have for your staff to help feel supported. Or if you've sent out any surveys or any just questionnaires asking, how are you? If you wouldn't mind sharing those templates with the group, that would probably be really helpful. If anybody's done anything like that.
We didn't have a benefit or like program that we kind of rolled out here in Denver. We've done a couple things that were actually, I found really helpful for our team. We've been flagging the EAP that we do have. Ours is just part of our benefits package. We're not paying for something separate. I'm finding a lot of people seem to not read those 5 other emails, and then suddenly the 6th one takes and they run with that program. The last couple of years, I've been trying to like flag that every couple months of we have these benefits, and we're getting a lot more engagement in that regard. We've also done some things kind of like on a company-wide level of like we had cut out like wood doves and we let people decorate them and we have those strung. We did the same with like some kind of art therapy, like clay work as well, and we've invited our employees to participate. There's kind of like a booth that people can go and they can decorate it, and then that gets added to the list. And that's been actually, I think, really helpful for people. I've heard a couple people here also mention like the therapy backgrounds, which I think is fairly common in HR for whatever reason. One of the big things that we changed actually in this office is the very bright fluorescent lights. We kind of brought that down. I brought in a lamp, and this feels more like a therapy office I used to have. And I think I've noticed people kind of being like, oh, this is a comfortable place for me to come and actually ask these questions. So those were like minor changes. I don't know if that's necessarily a resource for people, but we've had a lot of success with those for our team.
Thank you. That's really helpful. That's awesome. Does anybody have anything else they want to share?
I'm wondering if any of you have received the Leading Edge Pulse survey on employee engagement. They're just recently sending it out. If you've been part of the Leading Edge staff satisfaction survey, you should be receiving the Pulse survey from them. And if you're interested in having your staff take the Pulse survey, it's on the Leading Edge website, and you can click through to that and make that available to your staff. So it'll be really interesting because it's like, a real quick down and dirty kind of questionnaire about how are staff doing. And then they're going to collate all the information from hundreds of organizations, not just JCCs.
That's awesome. That's a great resource.
Thanks, Gideon, for sharing the meditation free link for, staff that want to, or anyone that would like to, have a place to be mindful and meditate, I think that's also helpful. Everyone manages stress in different ways. So any opportunity we could share that would, alleviate that for them is beneficial.
Yeah, the link that I put in the chat for Or Halev it's an organization that is grounded in Jewish mindfulness that draws on Jewish scripture for all of its mindfulness and meditation practices.
So are we going to go back? I know when I first came here, we did a whole training through JCCA with, oh God, I'm going blank on the rabbi's name, but that was around mindfulness and the Torah and this, for staff. Yes. The Institute for Jewish Spirituality. Thank you, Emma. That's who it was through. I was going blank. So is that going to be offered again? Because I think people found that helpful as well. And I know I participated in that, right? Along with like the J Response program with Mark Young, as far as resiliency and how we help our staff to be resilient and care for each other. Those are 2 other programs that I think we can expand on with our staff and not leave it at the management level.
Yeah, the Jewish mindfulness piece was wonderful. We had a grant that allowed us to then forward it to the JCCs to have their JCC staff participate. JCC Association staff as well participated, but we don't continue to have that grant. So they are doing the program, but now you have to pay for it.
Jill Sadowski just shared another, if you want to expand on it for us, Jill, another good resource called the Blue Dove. What do they do and what do they offer?
Sure.
Would be helpful.
Do people get that, Emma? I'm assuming you get that email. And they actually offer wonderful supports for an array of different. I mean, the piece I clicked was mental health, mental illness and addictions. They sent like a Hanukkah with how to bring mental health and wellness and Judaism into Hanukkah. So, for example, the Hanukkah email gives you reflections on mental health for Hanukkah. So it's just pulling it up to be a little more specific. There's a mental health journal that they have, and it's free downloads. A few things you have to purchase, but They have a mental health menorah. So it's super easy. They also offer a lot of things that I share with staff to give to parents so they can help guide for their kids. And they have wonderful resources. I would strongly recommend signing up for their emails.
Any other ideas while we wrap up as far as other resources you found helpful for your staff before we wind up today's sessions? We're getting down to that what point? Again, it's an opportunity to share resources so we can all take advantage of what's out there, you know, amongst ourselves. If not, you all have my email, so I'd love if you'd share with me and or with Joy so we can get them posted on the JCC resource page, as well as if you want to connect with Gideon directly, please reach out to me. I put my information in the chat again, as I think it's a great opportunity for us to take advantage of some coaching for our team, whether it's related to the war, whether it's related to organizational behavior, whether it's related to personal mental health, whether it's related to, I know the early childhood teachers, a lot of times they have their own concerns. So whatever it might relate to, you know, please, you know, reach out. We're here to help all of you manage this as, you know, HR professionals out in the community. I guess I'll turn it back to you, Joy, to wrap up today for us.
Okay, thank you. Thank you to everyone who had some spotlighted time and some time to tell us about the work that they're doing. I'm curious to hear from the people that are still here. What are some of the topics that you want this group to tackle in 2024? We're starting to plan for some of the next meetings. So either email your chair people, Michelle and Ashley, or email me. Let us know what hot topics you're thinking that you want to offer. And also use the email list so that you can be in touch with each other, bounce ideas off of each other, ask questions, post things there. This is the best way to continue to make this a real peer community of information givers and information askers. So you're all here, we're here to help support you. Thank you so much to everybody for spending some time with us today. Thank you to Gideon and Jill and Emma, and for Ashley and Michelle for coordinating this.
Thank you, guys. Thank you, everyone.
Thanks.
Take
Have a
care.
good day.
you.
Bye.
Bye all.
Bye.
Thanks, Gideon.
Thank you very much. If there's any follow-up you wish to have, I'm happy to make myself available.
Okay, I'd just be curious to find out what kind of response you get if anybody reaches out to you. So
Yeah, me too.
yeah, let me know.
Okay, thank you.
All right, happy Hanukkah.
Happy Hanukkah.
Bye-bye.